All right. Is everybody on? I can't see all the screens or whatever to see what's going on, but.
Yep, everyone's being admitted, so I think you're good.
All right. Well, welcome everybody to our Tuesday evening Equine Seminar Series. We're so glad to have such a great showing of you here tonight. 53 people, I think, have signed on, so that's great. We're happy to have everybody. And I'm very happy to introduce to you our speaker for tonight, who is one of my heroes, is Tom Divers. He's an excellent large animal clinician, especially interested in horses, and has a lot to share with us, and has done a lot of work on Lyme disease and experimental studies in horses, which he's going to share with you today. But we're really thankful. Dr. Divers has been a very big influence in my career and many other people. So we're very fortunate to have him and to learn so much from him, and for him to share his experiences on Lyme disease here tonight. So thank you so much, Dr. Divers. And I won't keep going on and on about how wonderful you are, but I could. And thanks for speaking tonight, and I'll let you take the controls, and I'll mute myself now.
Why don't Lindsay, you introduce us too, so people know us as the moderators.
Yes, perfect.
Good idea, Sarah. Hi, everyone. So my name is Lindsay Goodale. I'm Cornell's Equine Extension Specialist. I'm also an equine veterinarian. And Sarah Baseman, who's there with the beautiful background. Both of us, we kind of work together with Jillian and the speaker of the month to put this together. It's on the second Tuesday of every month, and Sarah and I will both be monitoring the chat. And so if you have any questions throughout, feel free to put them in the chat. If it's something you're confused about, we can stop Dr. Divers. He can address the question. Otherwise, we'll probably keep them to the end, but feel free to put any questions in the chat, and he's reserved some time at the end for questions. So thank you again very much, Dr. Divers, for sharing your knowledge with us, and we look forward to it.
Oh, thanks very much. My pleasure, and good evening, everyone. And today's topic, as you probably know, is on equine Lyme disease. And some of these slides may be a little bit technical, but I'll try my best to explain them so that everybody can understand. Hopefully that'd be the objective at least. And the Lyme disease is caused by this little organism right here, which is spinning around. It's a what we call a gram-negative, which means it stains a certain color, spirochete, and it has this little coil shape to it. And it's a very unique little organism that affects, it can infect a lot of different species, including humans, horses, dogs, and can produce disease. And I'll give you a little information on that tonight, and talk about what different clinical disease we see in horses with this infection is. And this organism, in order to become infectious, has to go through a life cycle within ticks. And the only ticks that really carry this organism, and I should say the only ticks that can carry and spread this organism and to infect mammals, are what's called the blackleg tick, also referred to as the deer tick. The scientific name is Ixodes. And on the East Coast, it's Ixodes scapularis. On the West Coast, you might guess it's Ixodes pacificus. And this tick starts out, there's eggs that happen from the adults, and then the little larvae.
Yeah, it's hard for me to know.
Develop. And then as those mature to nymphs. And the reason I'm telling you this is it takes actually 2 years to go from the eggs to the adults. Now, which ones are infectious? The larvae theoretically could feed on white-footed mice and other small rodents and become infectious, but we don't think they play a role in horses. They can in humans. So the little bitty, small pinhead-sized larvae could infect people if they've already been exposed to this spirochete organism. They have to feed on a white-footed mouse or some rodent like that that's infected too in order to get infected. And so then they develop, and they're still infected, of course, to the next stage, which are nymphs. Now, nymphs can feed on horses, but the main thing that feeds on horses is the adults. And one little point there too with these Ixodes ticks. The females are doing most of the spread. the males, which are smaller and do not become engorged, they actually stimulate the female to feed more aggressively, which means they can actually transmit the spirochete, the Borrelia organism, to horses and to humans and dogs more readily. But most of the transmission occurs with the female. Now, you can identify an Ixodes tick. You might have a tick on you, you might have a tick on your horse. Remember, it's called the blackleg tick. So if you look at the shell of it, it'll look just like this from the top. Now, if you flip them over and look at the bottom, they have this unique characteristic that they have this little anal port right here that has what some people call a McDonald's arch all the way around it. And they're the only tick that really has this structural feature. So, and this is the only tick that really spreads the Borrelia organism itself. But we see horses just loaded with ticks. Ticks are a major problem now. But this is the one that's responsible for spread of this infectious agent. And the small rodents are involved in the process. Now, it's called a deer tick, but deers really don't get infected with this organism at all. The deer is only important to maintain the host, which is the tick. And so that's why you'll find these ticks where deer are around, but the deer really have nothing to do with the transmission of the organism. They just provide food, blood meal for the adult ticks to survive. And, you know, I'll skip over this but some of you may have had your horses tested here at Cornell, and you'll see an antibody response against 3 different things. There will be an antibody response against what's called OSPA. Now, those of you who have had your horse tested will know what I'm talking about. Those who haven't had horses tested, probably this will be really Greek to them. But anyway, here at Cornell, we have a test that we can measure antibody against 3 different proteins that are on the surface of the spirochete, the Borrelia organism itself. And those are helpful because when we see an antibody against OSP-C, that means there's been a recent infection within the last 2 to 5 months. On the other hand, if we see an antibody against OSP-F only, that means it's more of a chronic infection. And why is that important? Because if the horse has clinical disease, it's much easier to treat it in early stages when you have an OSP-C antibody. And once they get into that chronic stage, it can be very difficult to treat them, very difficult. So it's a really unusual organism how it up-regulates and down-regulates the proteins in order to produce the infection. Now this slide is meant to just tell you that ticks are spreading throughout North America, and with them they're taking the infectious organism, the Borrelia burgdorferi. And we have some studies, this is seroprevalence here. And seroprevalence means the percentage of horses in the population that have been exposed to this infectious organism spread by the ticks, this Borrelia burgdorferi organism. And it can be really high in horses because horses get exposed to ticks so readily, and there's so many of these ticks around, and so many of them have the infectious organism in it. And this is actually a map from dogs because we don't have good horse maps, but we would expect horses to be just as bad, if not worse, than dogs. And this shows mostly in the Northeast, out in the West Coast, it's very common. You'll even find it down in the Southeast some, but it's predominantly a problem. I mean, it's a major problem in Minnesota, Wisconsin, all the way from Maine down to Southwest Virginia. When I first started doing Lyme research in horses, about 1999, because veterinarians kept calling and said, "What do you think about Lyme disease in horses?" And I was like, "Well, we don't know anything about it because there's no publications on it. No one has ever done experimental study. We just have no knowledge." But the first thing we did was start measuring antibodies. Now, the different assays have changed over the years. And by the way, there is this little snap one you could use on the farm, or a veterinarian could use right on the farm with a drop of blood, where you can actually detect antibody against the Lyme organism, heartworms in dogs, anaplasma, Ehrlichia canis, those type of things. But anyway, back in early 2000, we first started testing antibody. And at that time, we were only finding antibody down to Northern Virginia. But now we find horses that are positive for antibody all the way into North Carolina and sometimes beyond too. So the bottom line is there's good scientific information on this, that the ticks are spreading, and with them, they're taking the infectious organism. And then they have the proper small rodents to allow the cycle to perpetuate. So it's a problem we're not going to get away from. As a matter of fact, it's getting worse. And here's some horse studies. Now, these are adult horse blood samples submitted for like Coggan's test. But back even in 2005, 59% of horses, adult horses in Connecticut and New York, had been exposed to the Borrelia organism. That doesn't mean they had clinical disease. That's a totally different story. So the exposure and probably infection in horses is really high. And the clinical disease, we think, is actually quite low. And there are other studies too, that this one's biased here in Maryland. Surely 94% of horses haven't been exposed. But this was biased because these were samples sent in because they suspected Lyme disease. So you expect the seroprevalence to be high, which is the antibody. Probably the best studies from Southwest Virginia, Virginia Tech, which is my undergraduate alma mater, and their ambulatory clinic there just went out and tested healthy horses that they were just doing health exams on once a year. And they did the test in January, which is not a peak time for transmission of Borrelia, Lyme infectious agent. And they found that 33% of all the healthy horses that they tested in Southwest Virginia had been infected and exposed, infected to the Lyme organism at some point. And most of these were healthy, had no clinical signs of the disease itself. So we go on and on. So what does a positive antibody test mean? That's what we call serology. It just means that the horse has been, or still is infected. There's been exposure and infection that's taken place enough to produce antibody. It doesn't really mean that there's any disease process in any of the horses. And so a lot of exposure in horses, but we think that clinical disease is low. So this has what's called, so the horse has antibody. If you measure antibody, just remember it means exposure. It has a low predictive value for disease, since clinical disease in horses that are infected appears to be relatively rare. It does occur, but it's relatively rare. And the other thing about, I mentioned these antibody against OSPF, that's associated with chronic infection. And we don't know whether this chronic infection can just sit there in the horse's body for a long period of time in a quiescent state and maintain antigen to keep producing antibody, so the horse always has some OSPF antibody, or whether actually it can sometimes be activated and you could get a more active infection with possible even clinical disease. We don't know that. No one knows that. There's a lot we don't know about equine Lyme disease. So the question is, which horses should you test for Lyme disease? Well, if your veterinarian suspects clinical disease, then obviously test it, because you would expect almost all of them to be positive if they truly have Lyme disease causing clinical signs. But some people want to test healthy horses. And in general, that's not a good idea unless they have clinical signs that go along with the disease. Because do we do that for equine myelitis? No, we don't go out testing every horse for EPM, because we know that 80% of the horses have been exposed, have antibody. And it doesn't mean anything unless you can put the serologic test together with the clinical signs. So for pre-purchase exams, routine wellness exams, if a horse has no clinical signs, that really testing would just basically, if I use this expression, open up a can of worms. And so, if you want to do it, so for example, a pre-purchase exam, I might see if you're buying a horse for $200,000 and, you're getting a complete exam with radiographs and everything, if the horse is antibody positive for Borrelia, that's good. But if it were antibody positive, the chances of it getting clinical disease at some point are still quite low. But you'd rather have a negative than a positive in a situation like that when you're spending big dollars. Now, what have we done experimentally here at Cornell? Because to my knowledge, we're the only ones who've done experimental infections. So we have taken ponies that have never seen the organism before, have no antibody, and we infected those ponies. And most of them had no clinical signs whatsoever, but they did have some pathology, which means there's a potential for clinical disease. And we learned kind of where the organism goes. So for example, if you have, a tick female that's attached here, either adult or nymph stage, which is the middle and immature stage. If it's attached here, then it needs to be attached for about 18 hours or more in order to express the organism from the tick into the mammal, which would be either people, horses, or dogs. So the tick, if it's only been attached 2 or 3 hours, there should be almost no chance of transmission of the organism, because they require that 18 to 24 hours to do that sophisticated process I had in one slide, where they have to upregulate certain antigens and downregulate other antigens in order to get into the horse or people in order to survive once they get in. So the tick has to be attached for several hours, and then the organism goes into the skin. There's very little organism in the blood of animals, this organism, Borrelia burgdorferi. This organism likes to migrate through skin and connective tissue to get to the places in the body it likes to go. And where does it like to go? It likes to go to the joint membrane. It's called synovial membranes. That's probably the place it likes to go mostly. So what we learned from this study, we kind of learned where it goes in the horse's body. And it goes from the skin through connective tissue, which kind of protects it from the antibody and other things. It makes it harder to treat with antibiotics too. And the lymph nodes in the area of the tick attachment will usually be swollen. So you do get some swollen lymph nodes. And then the organisms wind up going, because there's when the tick regurgitates these organisms, it's not just one, it's many of the organisms. And they'll just go all over the body, but they love to go to synovial membranes and joints. Occasionally they go to the covering of the brain and the spinal cord. And they also like to track along nerves too. So the nerves can be involved with what's called hyperesthesia, meaning that when you touch the horse's neck, if those nerves are involved, they'll react to it in an abnormal fashion. So we learned a lot from that. And this is the pathology. And not to bore you with this, but you get some nodules in the skin, which are loaded with lymphocytes and the organisms in here. Lots of organisms in here. The lymph nodes are enlarged close to where the tick attached. The joint fluid, the joint membranes will be infiltrated with this immune reaction to the organism. And so the immune reaction plays a role in the pathology too. And here's a nerve infiltrated with those same white blood cells due to the organism. So we did learn a lot from those studies, but those ponies had minimal clinical signs, minimal. So what is clinical disease in horses? What is clinical Lyme disease? We've already determined that a lot of horses get infected, but probably very few have clinical disease. The best documented clinical disease syndromes in horses with Lyme disease are what's called neuroborreliosis, which is the neurologic form, meningitis, basically, uveitis, which means inflammation, infection, and inflammation of the uveal tissue, which is the iris, and this, what you see in this horse with a lot of infiltrate in the anterior chamber. And then they get a lot of nodules around the skin. These look like lymphosarcoma, like cancer, but they're not. They're called pseudolymphoma. And they're often at the site of the tick bite itself, but all of them are loaded with Borrelia organism. And this is the easiest syndrome to treat. These respond very nicely to doxycycline or minocycline, which are two of our favorite treatments for Borrelia in horses, and that's true in people and also in dogs. Now, there is a plethora of undocumented clinical signs that veterinarians talk about, and they may be true, and owners talk about, and that is stiffness in the horse, general stiffness, not one leg, but all 4 limbs stiff. behavioral changes, which could be related to that irritation around the nerve that I showed you on the previous slide right here. So certainly they can have behavioral changes. They can have hyperesthesia. You could have muscle wasting, because if these nerves are nerves supplying the muscle of the neck or the back, and they become inflamed, then you can have what's called atrophy of that. And so I think these do occur. I don't have any doubt about that. It's just, I'm saying they haven't been proven, but personally I have no doubt these do occur. But what I don't know is how common does it occur, because there's a lot of other things that can cause hyperesthesia of the neck, such as osteoarthritis of the neck. There are a lot of different muscle diseases that cause muscle wasting. There are actually not that many diseases that cause a shift in leg lameness other than laminitis in all limbs. So that one here might be a fairly big one. And unlike people with Lyme's arthritis, generally it's one or two joints. Often the knee is one of the most common sites. And there's effusion, I mean, there's a lot of fluid that you can feel in your joint itself. But in horses, we don't find the preferred joint really, and we don't find a lot of effusion. And maybe a lot of those cases that are blamed as Lyme disease are truly not Lyme disease, but there's a lot of work needs to be done on that. And it's going to take a lot more work to sort out all the different ramifications of Lyme disease in horses. Just recently, some of you may be familiar with pole evil, which is there's a bursa up here right at the pole of the horse that can become inflamed due to trauma. Well, we've had a few cases, the horse from New Bolton Center, that they called me about, and I said, well, you know, I've had a few reports from veterinarians that with fishless withers, which is back in the withers, and this would be a similar disease on the pole. I said, we've had a few cases where we found Borrelia there in the fluid. And so they tested this horse, and sure enough, it had lots of Borrelia in the fluid. Now, maybe it's an incidental finding. They did treat this, they did surgery and treat this horse with appropriate antimicrobials. I think it improved, but never returned, did not return to normal. The diseases we know, there's no doubt there's a Lyme uveitis. And my wife, Dr. Irby, is an ophthalmologist here, and we reported on the first cases. She had two horses from nearby, so it's in this local area, Cornell area, that had uveitis, and she was like, wow, this doesn't look like our typical leptospirosis or recurrent uveitis or moon blindness. These are rapidly progressive and often bilateral. And so we actually took fluid from the eye and sent it down to clinical pathology. And just with their regular stains in ClinPath, they saw all these little spirochetes. And they measured perfectly for Borrelia burgdorferi, the cause of Lyme disease. And then we did a genetic test to prove it was actually Borrelia burgdorferi. And this has been reported by several other people since that time. So this is not a disease you want a horse to have. You're better off having a leptouveitis than you are a Lyme uveitis, because these cases usually progress fairly quickly. They're often bilateral, and horses can be blind within 2 weeks. Oh, and sometimes they go along with central nervous system signs. So the same horse that has uveitis in both eyes with Borrelia burgdorferi may also have some incoordination of the limbs, some hyperesthesia, and evidence of nerve damage elsewhere in the body. And speaking of neuroborreliosis, this is well documented too. And lots of different clinical signs you can see. Once again, by neuroborreliosis, we mean the Lyme organism is in the nervous tissue, mostly around the spinal cord, sometimes in the brain, and sometimes even possibly around the peripheral nerves that are going out into the muscle. But anyway, regardless of where they are, they could cause muscle atrophy, weight loss due to muscle atrophy. Some of the nerves around the head can be affected where the horses cannot swallow properly. They can have some facial paralysis, which is really common in humans, facial palsy, where acute onset of damage to the facial nerve supplying the muscles of the face. And they can all of a sudden cannot move those muscles. Not as common in horses as it is in people. And then I mentioned if the spinal cord is involved, there's incoordination, and we have the hyperesthesia situation. One of the things that's reported a lot in horses, and this is tough to sort out, and that is that some of the horses with neuroborreliosis have almost an overnight episode The next morning, look at them, they cannot lift their head up. They're really stiff in the neck. And some of those have been Lyme disease, whereas others have been osteoarthritis of the neck that for some reason, as they move the neck overnight, they had lower joint mouse or something that caused this acute stiffness. But Lymes can do this. And this is the Lyme organism. I have to make this larger to see it, but these little red streaks in here, this is the horse that died from encephalitis due to Lyme, which would be a rare condition, but it did happen. And this horse, we did special stains to show that it has the Lyme organism along with inflammation right within the brain itself. Now here's probably the first case of Lyme disease, clinical Lyme disease I saw in horses, and could prove it later on. We had to pull out the tissues a few years later because this horse was euthanized. And this is a horse that came over from Fairfield Equine Clinic in Connecticut and wasn't very far from Lyme, Connecticut. And this horse had a, I think, 2-week history, a fairly remarkable, nice horse, had 2-week history of fairly remarkable weight loss, particularly in the neck. And this horse was so stiff and painful, it did not want to move its head and neck. This is actually a real video, but when I start this, you're going to think it's just a photograph, because this horse did not want to move. And the reason this horse didn't want to move is because it had nerve damage, leaving the spinal cord and neuritis, and it was extremely, extremely painful. It would keep that one foot out in front, and then eventually it would move it back, maybe paw a little bit and move a little bit. And then it would go around, it would stand, and maybe even put the other foot out in front also. And both sides of the neck were equally involved. So this is a really painful horse. Now we treated this horse with oxytetracycline, and it improved greatly. It actually sent it home, but it never regained a normal gait. And the owner did not think that it was safe to ride. Sorry, the owner didn't think it was safe to ride, so they donate horse to us, and we horse had an autopsy performed, and we found abnormalities. But only a few years later, after we developed some more molecular tests, could we pull out the tissues again from the autopsy and test it for Lyme to prove it actually had Lyme in its lining of the spinal cord. So how do we diagnose Lyme disease? Since so many horses have antibody, and remember antibody only means exposure, well, most of them should have antibody, number one, so you will test for antibody. The other thing is they need to have clinical signs that are compatible with the diseases we've talked about so far. Shifting leg lameness, hyperesthesia, uveitis, the pseudolymphoma, skin nodules, things like that. There are probably more signs that we don't know about. But it's easy to make a diagnosis of Lyme disease because 70% of all horses may have antibodies. So you could blame laminitis on Borrelia, but there is actually no scientific evidence anywhere to strongly suggest that this organism has anything to do with laminitis. But if you look at 20 horses with laminitis, probably 15 of them are going to have antibodies just because the exposure is so high. So what I'm saying is it's an easy diagnosis to make, but it may not be the correct diagnosis. Make sure that other diseases are ruled out that could cause those clinical signs before jumping on the bandwagon that the horse has Lyme disease. And we have, unfortunately, necropsy, have autopsy enough horses that we have some idea of what they look like. We know, I told you about the experimental ponies where they get this infiltrate of the synovial membranes. This is what the covering of the spinal cord looks like. Here's the spinal cord, and this covering called the dura should be very thin, but very few equine diseases will do this. The covering of the spinal cord and brain becomes really thick, chronic infection, chronic inflammation. And I'm not sure very many other diseases would do that. So we do have some idea of what to look for, on autopsy, but we'd certainly rather that not occur. We'd certainly rather make a diagnosis and have a good treatment outcome, which means what horses should we treat? Well, we should treat horses that mostly have antibody, meaning they've been exposed. and have clinical signs of diseases we've talked about so far. And we should not treat based on antibody alone. We should not treat based on antibody alone. Now, I put this in myself. Does it make sense to treat horses with elevated OFC, even if they show no clinical signs? So that could be the one exception. Because remember, when we have an antibody against this OFC, which you'll see on the Cornell test, that means it's been a recent infection, and that means it's going to be easier to treat at that stage. Because once it becomes chronic, it's more difficult to treat. But just because they have an elevated OFC, what are the chances of that horse actually ever having clinical disease? Probably really low. I cannot give you a number, but it's really low. But if you were going to treat a horse based on antibody alone, this might be the time to do it, just because you'd be more likely to actually clear the organism from the body because it's early infection. But I'm not a proponent of it, but I can understand how somebody might want to do that. So what is our treatment for equine Lyme disease? Well, we base our treatment mostly on studies that have been done in humans and dogs. We actually did a drug treatment study here at Cornell. And this was many years ago, probably 2000. We published in 2005. And so we have done one experimental study where we experimentally infected ponies. And we treat them with either doxycycline, tetracycline IV, or Naxal, Septicure, I give an IM. And what we found out is that with the doxycycline, only one, and these ponies were eventually had autopsy performed, and we looked for organism in their body and live organism. And of the 4 ponies treated with doxycycline, actually 3 of them, they were treated for 1 month. And then they were left for quite some time. None of them showed clinical signs, but 3 of the 4 still had organism in their body. And only 1 was cleared. Now, before you say, well, gee, that's the most common drug we use. Well, this was in 2003 when we did this, and we were underdosing them. I mean, we know now based on what's called pharmacokinetic studies, pharmacodynamic studies, that we were using doxy at the dog, the human dose, and horses have poor bioavailability of doxy because most of it's not absorbed. So currently, we are given double that dose. So if we repeat this study, I can only speculate that doxy would have been more effective than it was in our study. Now, the tetracycline, all 4 ponies that got tetracycline intravenously cleared the organism completely. No live organism in the body. So remember, we infected these ponies experimentally, and not too long after the infection, 3 months afterwards, we gave the antibiotics. Now, in real life, you might not notice clinical disease if it ever occurs until it's been, 5 or 6 months. At that stage, it's more of a chronic infection. So these were, not subacute, but, fairly acute infections. So we would expect a better response with that. And then Naxal cleared 2 of the 4. And we've done some further work on Naxal to suggest that, you could use that as a treatment and it'd be a reasonable thing to do. So that's how we've arrived. Other drugs that we know could be effective would be what's called beta-lactams, which are penicillin and ampicillin. But unlike dogs and humans, those have to be given by injection. You cannot give them orally. And a lot of horses that have Lyme disease need more chronic treatment, meaning at least 1 month. And the reason for that is because we don't get a chance. Remember, humans with early Lyme disease, about 50% of people have a bullseye skin reaction. And that tells them right away that there's been a recent exposure to Borrelia, an infection. But we never see that little bullseye lesion in the skin of horses. It's probably not there. If it is there, we don't have an opportunity to see it with the hair coat. I don't think it's actually there in horses myself. And so we don't really have a chance to treat really early in horses. We're always treating like weeks down the line, which makes our antimicrobial treatment a lot less effective than in people. And once again, this slide is just saying that we're using the same treatments they use in people, but we've learned that the bioavailability of the drugs are a lot different between horses and people. We have to use higher levels of the drugs, which means the expense is higher. We cannot use oral ampicillin and penicillin and those type drugs, cephalosporin, because it upsets the horse's GI tract and they don't absorb those products really well. So we have to inject those. So it's much more difficult to treat Lyme disease in horses than it is in people or in dogs. And how long do we treat them? Well, the half-life of antibody is, 30, 40 days or something like that. So if we actually treated the horse successfully and killed all the organism so it was rid from the body, then the antibody would disappear as long as it didn't get reinfected again. And so basically, we'd like to see a continual decline in antibody over a 3-month period down to what's considered negative levels based on our test here at Cornell to be certain that the organism is gone. Now, that's possible that be overtreatment, but in order to be really certain that the organism has been eliminated from the body, we'd like to see the horse become antibody negative, but that may not happen in many of the cases. Are there other treatments that we use other than antimicrobials? Well, corticosteroids suppress the immune response, so you probably don't want to do that. But that being said, if the infection is in the eye or the central nervous system, which is really unforgiving to disease, then you need to control the inflammation. It's kind of like COVID in people. They've learned now that if you have really severe respiratory disease with COVID, give dexamethasone and control the inflammation in spite of being a viral infection. Same thing here. If you have a critical organ, such as the eye or the central nervous system that's involved with Borrelia infection, and the horse has clinical signs, if you have any chance of that horse going back to be a reasonably normal, useful, non-painful horse, you might want to give corticosteroids along with antibiotics early on. But it'd be only for those critical, unforgiving organs, such as the eye and the central nervous system. Otherwise, the corticosteroids are just going to suppress the immune system. Non-steroids, phenylbutazone, flunixin, banamine, they may make the horse feel a little bit better, but they're not going to have any really great effect on outcome in the horse. And then we get asked all the time about acupuncture and herbal treatments and those type things. Well, we had a group that got together who were interested in equine Lyme disease, and we scoured the literature to try to find everything we could about human, canine, and the little bit that was published on horse Lyme disease. And when you look at the human data and the canine data, there are articles on using acupuncture and herbal treatments for Lyme disease in humans and dogs, but it is hard to find those articles. And when you look at the quality of the articles, as far as the number of cases and how they proved it was Lyme and how they proved the person or the dog actually recovered, it wasn't high quality. And so there's not good evidence out there to support the use of these. I'm not saying they may not work, but I'm just saying there's not good scientific evidence in humans to support the use of complementary treatments, and that may be so in horses too. Now, that being said, if the horse has a lot of back pain due to neuritis, and you think it's Lyme disease, we'll treat Lyme disease and use complementary treatment just to relieve the secondary part of the disease, which would be stiff back associated with the neuritis and things like that. So doing that would be very, very reasonable to do. And that's commonly done in practice. So what is the prognosis of horses with Lyme disease? Well, if it's uveitis, a neurological disease, it's 4. It's as simple as that. If it's a shifting leg lameness or a general stiffness type problem in horses, then we frequently get a clinical response where the horse is improved. And some of these horses go back to be normal horses. So we probably completely eliminate the organism from the horse. In other cases, the horse gets better as long as they're on antimicrobials, and then you take them off antimicrobials, and sometime over the next couple months or year, they may relapse with almost identical clinical signs. That probably means we actually never eliminated the organism. If we were to treat them longer, maybe we would eliminate the organism, maybe not. Tick control, that's where it all starts, because without the ticks, the Borrelia wouldn't go get into the horse. And remember, the adult females are doing most of the transmissions, although the nymphs the smaller ones can also transmit the organism, just not as commonly in horses. So if we could just control the ticks, we'd be better off. Vaccination, we don't have an equine Lyme vaccine, but I'll talk about that in a few minutes. We need better tick control in horses. I mean, in dogs, it's like the state of the art. I mean, there's so many things that can be given orally, once a month to dogs, drugs, the tick and flea collars. But in horses, the only thing we really have are the pour-ons and sprays. And most of those are based on pyrmethrin. And so we can dust or spray those on the mane, tail head, chest, underbelly, where ticks commonly get. But there's relatively short acting, and we have to just constantly, keep doing those treatments to control the ticks. Other things you can do too is most of the ticks like to crawl up on weeds and tall grasses to get on the horses. And if you keep the pastures clipped, that helps. And then probably the worst place for ticks is at the edge of fields where there's weeds and leaves and things that accumulate. Ticks love to be in those areas like that. And so if you keep them away from the brush type areas on the edge of fields, that would be helpful too. But it's impossible, ticks get on me sometimes, and dogs, and it's just, there's so many ticks now, and it's not getting better, it's getting worse. As far as vaccination goes, well, that was the third study we did. We did a vaccine study before there was, I think, about the same time the first dog vaccine came on the market. We actually made our own here at Cornell. Dr. Chang, who's a really clever microbiologist, he made a vaccine which is almost identical to the one that eventually Marielle used for her dogs. And it's a vaccine that has just the one protein in it, which was that OSPA, which when ticks infect horses with Borrelia, this OSPA is a protein on the surface of Borrelia. So in a process of going from the tick gut to the horse or the dog or humans, that's why it takes 18 to 24 hours. The organism, the Borrelia organism, it downregulates this A because it doesn't want to show A to the mammalian infected animal, person, dog, or horses. It wants to hide that A. And that's telling you right away that the A may be a good vaccine because the organism itself doesn't want to show that A because they produce antibody against it really quick, and then that antibody can be quite effective if it's early in the disease. So most horses that are infected are negative for OSPA. A few are positive, and some of them even have clinical disease with OSPA. But it makes sense that OSPA, and what I'm getting at, would be a good antigen to use, a good protein to use, because the Borrelia organism wants to hide it in the natural infection process. So we've made recombinant OSPA in the laboratory, Dr. Chang did, and we infected ponies, and they got really nice antibody levels. They went up really high, but they also come down really high. So that's what we found when you use the dog vaccines in horses. Most of the horses, not all, will get a fairly good immune response with good OSPA antibody. And that antibody, when it's high, is protective. We recently published an article on that. It shows the higher the A antibody, the more protective it is. But it's not totally protective in all the cases. The problem with the dog vaccines used in horses is that all of them have short-lived antibody production. So you vaccinate the horse 2 times in the beginning, and the antibody shoots up, and then it's just the natural half-life of IgG, which is around 30 days. So over a period of another 3 or 4 months, you're back to negative again, almost no antibody. So you have to booster the horse again. So based on the dog vaccines we have now, if you want to use those in horses, you'd probably want to start with a 2 booster series, and then you'd want to booster again after about 5 months. And remember, the peak time for transmission from the adults is probably going to be in the spring and the fall. The fall would probably be the most common. So you want to kind of time your vaccines realizing you're not going to get a year's worth of protection out of 2 doses of the vaccine. You may want to time your first vaccinations and your booster so that you make sure you have some good antibody levels in the spring and the fall of the year. And so we have looked at that, and I mean, same thing here, up and down it goes. And that's about all I can tell you about that. Now, the A is not the only protective antibody. We talked about OSP-C, which is actually shown by the organism really early in infection. And they make their own antibody against it, but it takes a while. So if you had a vaccine that had C in it also, which one of the vaccines does now, the Zoetis one has, the dog vaccine, it's possible that the A and C together could be better than the A alone. But I think the A has stood the test of time. And there was a human vaccine on the market back in early 2000, and it was based on A also, and it works. There's one available in France now for humans based on A. It works. It was taken off the market in the US because people complained about some side effects from it. And the company that had it basically said, well, there's not that many people using the vaccine anyway, because Lyme wasn't as prevalent in people back in the early 2000s as it is now. And so they say it's not worth it to us for lawsuits. So they just took it off the market. And those side effects were never really proven to be due to the vaccine itself. And there is the only approved equine vaccine is in Europe. There's an approved OSPE equine vaccine in Germany. So what does equine and human Lyme disease have in common? Same organism, same means of transmission, the same time the tick needs to be attached to you or the horse. Same diagnostic tests are being used. Actually, some of the tests we have in veterinary medicine are better than the ones in humans in some ways, because in humans they usually use a 2-step process. They use a basic antibody test, which just measures antibody, and then they send it for what's called a Western blot, which tells you there's antibody against specific proteins such as the C and the F and things like that. Whereas we do it with just one test, we can tell you pretty much the same thing. And the little IDEX test called the C6 test that I showed you the picture of, which takes 1 drop of blood, you do it on the farm, takes 10 minutes to get the results. It actually works pretty well, but it only picks up antibody after, several weeks after infection. So, but none of our tests will really pick up antibody early in the first couple weeks of infection. None of them will. And the other problem is, what else? Clinical improvement following antibiotic treatment does not validate a Lyme diagnosis. So, for example, you have a horse with chronic stiffness. It's antibody positive for Lyme. It's been exposed, but so many horses have. So you jump to the conclusion, hopefully you worked up other possibilities veterinarians would have, but you conclude that, hey, this is Lyme disease. So you put the horse on doxycycline and minocycline, and within 2 weeks, the horse is better. And it does well even for a while after you stop the antibiotics, after maybe a month or 6 weeks of therapy. And then the clinical signs recur. Well, maybe it was Lyme disease, and we just didn't kill the organism, as I mentioned before. The other possibility is maybe it was another disease, and the antibiotics produced anti-inflammatory properties. And doxycycline and minocycline do that. They have anti-inflammatory properties that sometimes lame horses with pain elsewhere other than their limbs, you put them on doxycycline and minocycline, and they get better because they have anti-inflammatory effects too. So that's why, and that happens in people and other species also. So if the animal improves with doxy and minocycline, that's great. But it doesn't really completely prove that the horse had Lyme disease. Now, in horses and humans, both, that have been through a course of antibiotic therapy and the clinical signs went away, but they still maintain antibody, that might mean the organism's there, but it's probably in a quiescent state. And there's no evidence to keep treating those horses. long-term, meaning months, if they don't have any clinical signs. So basically, you just don't treat based upon antibody alone. And once again, we need more help with tick control. I tell everybody wants to make a vaccine, kind of like the COVID vaccine. That's where the money is. And for preventing disease, all the drug companies, doesn't matter who it is, Boehringer, Zoetis, Merck, they always want a vaccine because that's where the money is. But I keep telling them, how about some tick control? Because in small animal, that's where the money is. And I think, we don't have the number of horses that people have dogs, but I still think we are really in need of more research on tick control, as much so as we are in having an approved Lyme vaccine, because we can use the dog vaccine. And I've showed to you, and we've proven they do work. May not be 100%, efficacious, but they're safe and they do work. And so we have those, but there may be an equine approved Lyme vaccine in the US at some point. What are future directions for research on Lyme disease in horses? We need to figure out how many of these antibody positive horses actually have clinical signs from the infection. I mean, my guess is that it's a low number. And my guess is that the disease is probably overdiagnosed because it's really easy to do that. But do I have proof of that? No, I don't. I mean, maybe the horse cannot tell us that it's got some low-level pain associated with the Borrelia chronic infection. But a lot of people don't have clinical signs too. Not every human who gets infected has clinical signs. A lot of dogs do not have clinical signs that become infected. And we need a better test, not to just tell us that the horse has antibody. We need some better tests to actually find the organism in the body. For example, if it's in the synovial membranes around the joints, we need some procedures so we could get a little sample of that and take a look at it under a microscope and say, oh yeah, not only has this horse got antibodies, been exposed, but this horse has the organism right there in the joint fluid or the lining of the joint, and it's got an inflammatory response to those lymphocytes. So that's Lyme disease. So we need better ways to prove not just exposure, but we need better ways to prove that the organism is still in the body of the patient. And that's a problem in humans also. Finally, a couple last comments. Borrelia burgdorferi, which is the cause of Lyme disease, is not the only pathogen in these Ixodes ticks. It's the most common one by far, infection transmitted to horses. But they have a lot of other organisms, and we're probably going to learn about more as time goes on. There's a Borrelia mayoni, which was found in Minnesota and Wisconsin. It was found at the Mayo Clinic. That's why it has this name here. And it cross-reacts, means, in other words, if an Ixodes tick does have Borrelia burgdorferi or has a co-infection with that plus Borrelia mayoni, then if you measure antibody, it will cross-react with the Borrelia burgdorferi. So they'll be antibody positive regardless of whether it's the main Borrelia burgdorferi or whether it's this one. But this organism is only found in, so far, Minnesota and Wisconsin. And it doesn't produce the same signs as you get with Borrelia burgdorferi. So it's not the classic Lyme organism, but it's considered a Lyme infection because the antibodies on the blood tests will cross-react between the two, if that makes sense. This one actually produces more of meningitis, which could see with Borrelia burgdorferi, high fevers, but once it's geographically limited so far. Then there's another Borrelia, a Borrelia myomotoi, which doesn't cross-react with antibody. So if a horse were to be infected with this from the Ixodes tick, then it would be antibody negative to the Lyme organism. And so you wouldn't really know. There are some laboratories now set up because we don't know. We haven't found this in horses in the Northeast. It's in people in the Northeast. It's in the ticks in the Northeast. So I bet horses are getting it, but we don't know if it produces disease. And so far, there's not a lab that's readily available to test for the antibody for this, because this one doesn't cross-react with the Borrelia burgdorferi. I think the Yukon lab may have had this for a short period of time, an antibody test, but I'm not sure it's available right now. I don't know. And then, of course, another one that we notice here in the Northeast is spread. All these are spread by these Ixodes ticks. And the Powassan virus, that's been found in New York State the last 2 summers. It's mostly a summertime disease. And this produces high fevers, occasionally encephalitis. And the thing that's a little bit different about this one is the tick only needs to be attached for a few hours rather than 18 to 24 hours for transmission. It's transmitted much quicker from the tick to the person. And there's no information on this in horses right now. But we need to probably research, particularly these 2 here, because we know they're in the ticks in the Northeast, to see if they actually cause disease in horses or not. And there's probably other agents we don't know about. And as a matter of fact, there is one really common organism. I mentioned this at the very end. I think this is the last slide. But you probably heard of an organism called Anaplasma phagocytophilia, anaplasmosis. This is another organism that's transmitted by the Ixodes ticks. And a lot of Ixodes ticks, we have tested this. If you go to Connecticut or even Eastern New York, not quite as bad here, but it's getting worse. If you go and you just go through, if you take like a burlap sack, an old feed sack, and drag it through the woods, you'll collect tons of ticks certain times of the year, particularly in the fall. And then you can take those ticks and you can test them for these different infectious agents. And when we were doing our experimental studies, we collected ticks in Connecticut. We found about 50% of them had Borrelia burgdorferi, the cause of Lyme disease, and about 20% had anaplasma phagocytophilia. Now, anaplasma phagocytophilia is a well-known disease in horses, well documented. It affects only adult horses, and the horses develop high fevers, 104 temperature, become depressed, often get leg edema, but not always. And when they get this leg edema, they become stiff. They have jaundice. And then when we do CBCs, complete blood counts, we find out that their white counts are low and their platelet counts are low. And right here's the organism itself. This is a neutrophil. Here, these are red blood cells. Here's a neutrophil, and there's the organism right here. It's called granulocytic ehrlichiosis. It used to be known as Ehrlichia, but now we know it's really anaplasma is the name of the organism. And this is the little chart here that tells you what happens. And it's a common disease. It's become fairly common here in Western New York in horses. Younger horses can be infected, but basically it's the adult horses that show the clinical disease. So the tick attaches, it transmits the organism. It may transmit this organism and Borrelia burgdorferi at the same time. And then just within a matter of 5 or 6 days, you can find the organism in the white blood cells. Now this, you would not do this with Lyme disease because it's usually not in the blood. It's in the connective tissue and goes throughout the skin, nerves, etc. But in this case, it goes to the blood, produces that high fever, which we don't see with Lyme disease. I should have mentioned that. We rarely see. If you have a horse that's had a lot of ticks on it, it's got a high fever, well, it's either anaplasma or it's one of these diseases we don't even know about yet, because high fever is not going to be from Lyme. Occasionally, ticks themselves, tick bites, will get kind of nasty infections, which can cause fever, but that's not Lyme causing the fever. It's other bacteria that get in there. But this causes high fever pretty quickly. Horse becomes depressed, decreased appetite. We see this organism in the blood smears. You can do genetic tests and you can prove it's there. And some of these horses become incoordinated too. And the limb edema is fairly common. And if you don't treat these horses, what happens? They get better on their own. They get better on their own, usually within a period of about 10 days. But, you know, we don't want the horse to suffer with fever and so forth. So you give them a dose or 2 of oxytetracycline, and they return to normal really, really quickly. And then we usually recommend treatment for probably a week with minocycline or doxycycline. The IV oxytet works best because it gets higher levels in the blood quicker and in the body. But if you cannot do IV oxytetracycline, you could start with doxy and minocycline. It just takes a little while for it to work longer. And remember, the mortality with this disease is extremely low. That's not true in people. People who get infected with anaplasma phagocytophilia, can get what's called multi-organ system failure, septic shock, and can die fairly quickly. It's not a high percentage of people, but it's an alarming number of people. If they're not treated appropriately, it can actually be a fatal outcome. Most of the MDs here know about anaplasma now since it's moved into the Western New York. Back when I first came to Cornell in 1990, we didn't see anaplasma here. It's extremely rare. And we didn't see a lot of Borrelia burgdorferi, horses with antibody to Lyme organism. But now we see both. And so it's the ticks, once again, the ticks are moving and taking these infectious agents with them. So that's pretty much it. We're pretty much out of time. I'll be happy to take a couple of questions. However, Sarah, or however you guys want to do this.
Hi.
Lindsay?
Yeah, thank you so much, Dr. Divers. And we do have almost an overwhelming number of questions, so we'll try to get through a few, probably not all of them.
Okay, you just pick up the ones you think are most important. You can probably see the repetition. So go
Okay. And thankfully, Dr. Bettina Wagner has been in the chat answering some questions in case some people weren't aware who was responding. She is also at Cornell and does some research in this area. So that's who was responding. So an early question was someone asking whether the hyperesthesia can remain after the horse is successfully treated.
It potentially could, because nerves are slow to repair. But I would think that eventually, over a period of months, that it should go to normal if the organism is eliminated from the body and there's no additional inflammatory response. But nerves take a long time to regenerate. I mean, they're slow. And so, yeah, after the organism is gone from the body, it could take months for it to return to normal.
And then there's also someone asking about whether mares with Lyme disease can have healthy foals.
Yes, I don't know any evidence that there's been any abortions associated with it.
I could only find one report from the 80s, but it sounded extremely rare based on that report.
Yeah, it's kind of like Potomac horse fever. Potomac horse fever also cause abortions, but they're darn rare. And I'm not aware of Borrelia.
Yeah, they isolated it from only 2 foals, so it seems quite rare.
Were the foals aborted foals or sick foals or what?
One of each.
Okay.
Mm-hmm.
And once again, it may be there because the organism migrates through.
Right.
I'm not sure. Obviously, it must get across the placenta. So whether it actually was the cause of the abortion or not would be in question, I guess.
Exactly, right. But so, in summary, not much evidence of that.
No, there's very minimal.
So someone's asking, I'm not sure if I'm interpreting their question correctly, but they said in a chronic horse, maybe they mean chronically infected with Lyme. Is there any benefit of regular testing and or cyclical treatment?
If the horse is chronically infected, then you expect the antibody, particularly the OSF and the C6, the IDEX test, the OSF, the Cornell test. You expect those to probably remain positive. But once again, unless the horse is showing clinical signs and doing just cyclic treatment, I don't think it's going to do any good because it may be the organism's in a somewhat quiescent state.
Right.
And when they're in a quiescent state, they're probably not going to cause disease. And trying to guess when they may go back into an active infection would be just guesswork. So I'm having a hard time figuring out how you'd want to do cyclic treatments with it, to be honest with you.
Yeah, I wonder if they mean repeatedly coming back positive. I'm not sure about that.
Horses, that's the other thing I alluded to but didn't say. Just because the horse has been infected with Borrelia one time and you treat it and actually completely eradicate the organism, they can get reinfected.
Yeah, right. Fair point. And then a question kind of also related to treatment. Someone's asking whether you have to worry about dysbiosis with long-term tetracyclines.
We do, but that's actually an interesting question, and I'm glad you asked that. Whoever asked that, because we didn't have Borrelia infections here in Western New York, or minimal, in 1990 when I came here, and it was the practitioners in Eastern New York and in Connecticut and New Jersey that started seeing a lot of antibody positive horses exposure and diagnosing clinical Lyme disease, in which some cases probably correct diagnosis, in case incorrect diagnosis. But the point of the story is they're the ones that started using doxy and minocycline given orally. And I said, oh my gosh, our isolation facility here is going to be full of horses with diarrhea. It never happened. It never happened. And I looked it up, and what happens is, although doxy and minocycline are not absorbed very well in the small intestines like they are in dogs and humans, we've talked about that. But when they go down to the cecum and colon, the lower GI tract of the horse, there's forage there, right? Those antimicrobials become inactivated by the forage. Probably not 100%, but that's probably the reason that we don't see. Occasionally you'll see a horse with diarrhea. Occasionally you hear a report of a horse with serious diarrhea. But I mean, thousands of horses have been treated with doxyminocycline, and most of them have no problems.
Yeah, thank you.
But it has led to an overuse of antimicrobials, though, because we're always trying to limit the number of antibiotics we use because of the effect of spread of mutation in the bacteria and these called plasmids and things. And so I think, it's probably no doubt that these antimicrobials have been overused, and that's probably not a good thing for our profession.
Yes, and maybe to go along with that, we can have a final question of a little case someone has presented. They say horse tested equivocal on OSPE and OSPC. They have controlled IR and PPID with a history of laminitis, but they have a clinical sign of being tender-footed, and they're asking if you would treat for Lyme.
Oh, no, I would not, because there just isn't any scientific information to support those types of signs of laminitis or tenderfoot associated with the infection. And if the patina could respond to that, but if the results are equivocal, I mean, that's doesn't say that there's not infected, but I don't think it really completely confirms they are infected. I mean, I think horses, and Bettina would know better than I, but it seems like horses have different background levels and so forth, and when they're equivocal like that, it's hard to get too excited about it.
Mm-hmm. Yeah, and actually she did respond in the chat and said that might be a good question for you, so I thought I'd ask you.
No, I wouldn't treat. I wouldn't.
Yeah. Okay, well, there's the final word, everybody. Thank
That
you very
doesn't mean I'm
much.
right now.
What? Yeah.
That doesn't mean I'm right. I'm just giving you my opinion.
Thank you very much. Everyone's saying thank you in the chat, and we really appreciate the time you took to share with us.
Oh yeah, like I say, I'll be retiring soon, so many of you I probably met through the hospital and so forth, but if I haven't met you before, it's nice to have you on the chat, and for those that I've seen in the hospital, I hope the horses that we treated did okay. Most of them did okay, and the service here was good, and enjoyed working with those who have been here to the hospital, and I've been here now for 31 years, so I've probably seen many of you. So have a nice evening.
Yes, thank you very much.
We just wanted to let everybody know about next month. Our next seminar is going to be on November 10th, and a new faculty member in ophthalmology at our hospital, Dr. Gilbin Shlomo, will be presenting I Spy with My Big Eye, What Do Horses See? So if you haven't gotten it already, you will be getting the e-vite from me, and our website will be updated on that as well.
And
So
some of you who may have met him, actually, he presented a station at our equine hospital tour last year. So if you were at that, you met him.
Yep,
and he's
exactly.
a great speaker.
Yep. So we hope you guys will join us.
Thank you, everybody. Megan, the recordings are on the Equine Seminar Series page. It links to